Good morning. Thank you all for getting up early and joining us for this mock study section. So my name is David Chaplin. I'm joined by two volunteer faculty. Oh, they're not volunteer faculty. They are volunteers from the faculty. Dr. Karen Cropsey is a professor in the Department of Psychiatry. She's a behavioral researcher who mostly studies drug addiction and drug-related issues. Karen Gamble. So this is actually quite realistic. So Karen has a, I guess, upper respiratory infection. I'm not sure exactly what. Feels pretty crummy. He's going to face that way most of the time. So some of you may want to move this way. But people take their review commitments really seriously, and you have to be deathly ill to not show up to study section. So she's doing her thing the way we all should handle this. So our goal today is really to try to sort of demystify the process of the NIH grant review activities. Well, first of all, the experience of writing a grant is pretty discombobulating, and you don't really, particularly if you're doing it for the first time or two, don't really know whether you're doing things right. But even worse, once you send the grant off, then it's a black box and you don't know what happens until you get your review back. And more often than not, because only 15% at the best of grants get funded on each round, you're going to get a score that's not fundable. And you don't really know what happened that make that happen. I actually think that what the NIH did about 10 years ago now to try to make the burden of writing the reviews less serious on the reviewers was to make it all, the review comes to you in bullet points rather than in a more sort of discursive narrative format. And personally, I find that that kind of review is a little less useful, although I'll try to show ways in which the reviewers try to give you useful information. But it's not always clear exactly what they mean from the review you get, and it's not clear exactly how what you wrote ended up resulting in the review that you got. What I hope you'll see by the end is that, first of all, that the process is really there. The reviewers are not devils who are trying to ruin your career. They're people who are trying to make the wisest decisions they can for how NIH money is going to be spent and how science moves forward in a productive way. They try to give you feedback. They don't view it as their mission to tell you how to do your experiments, but they try to give you honest feedback about how the experiments you've proposed appear to a pretty expert individual and panel. So I don't have a lot of slides to show here, but I wanted to just highlight a couple of things about the review process. It's not advancing. Thank you. So what I'm going to do today is provide a brief intent. We're going to talk about K Award today. So we have a mock study section every year, and we try to alternate years between an R-type grant and a K-type grant. So this is the K year. I'm going to give a brief review of the grant review process. I'm sorry? Oh, it's not showing all the way at the top. I don't think there's anything we can do about that, really, probably. Okay. Just for my interests, how many of you watched the YouTube video that was recommended during the, if you haven't done that, if you search for NIH grant review revealed through YouTube, it's a very worthwhile 12-minute video, and I'm not going to repeat all the information that came out of that, except for a few points. I really recommend that you look at it because it's full of useful information. So we'll talk about how the review process works and try to give you some pointers about recognizing how the review process works, how you should use that information to help make your applications more easy to read by the reviewers and more likely to cover the issues that they really want to hear about, so that you'll get the best score you can get. Then we're going to, one of your colleagues who actually, so many of the people in this room have been in the clinical and translational science training program for the last 6 months, and this is the final session of that. So the person who allowed us to use her application, Dr. Sharon Yara Fisher, was a student in that class about 6 years ago, I think, and then she actually received a CCTS KO2 award, which is a 2-year K award that's supported by the National Center for Translational Science. And then this is her application for continuation of that through an individual K. So we'll do a review of her initial submission, which was not funded, as typically happens, and then talk a little bit about the process of what you should do to try to respond to an initial review if you're encouraged to resubmit, which she clearly was. And then we'll review the revised application, and then we can have time to talk and answer your questions. So if you watched the YouTube video, one of the things you saw was that the review panel is larger than the people who actually are primary, secondary, and tertiary reviewers of each application. So most study sections have somewhere between 12 and 25 individuals. I've been on ones that had 60, and that's pretty unmanageable. But one thing to realize is that every individual on the panel scores every application unless they have a conflict of interest for the application, in which case they actually have to leave the room while it's being discussed. But otherwise, they score. So they pay attention to what's being said by the primary, secondary, and tertiary reviewers. They don't have time to read all the applications. There's usually, in a study section with review case, there might be 30 to 40 or 50 applications, and about half of them actually get discussed. The other half don't get discussed based on the scores they get as preliminary scores. And so anyway, the reviewers are looking at are listening to the reviews of the grants that they didn't personally read as a presenting reviewer, but they also will often look at the specific aims page and the abstract and selected stuff in the application. So what that means is that, first of all, your specific aims page is crucial because it's the one page that most people who are going to score your grant will have looked at some level. So if you join any of the grant writing groups that a number of parts of our institution support, you'll see that there's a lot of emphasis placed on making sure your specific aims page is not only really smart science, but is presented in a way that allows an average, well-informed scientist to understand what you're trying to do and to do that, to pick up on what you're trying to do as effectively as possible. Okay, so K awards. So the crucial aspects of a K award are that they are career development awards, which means that they're mentored, and they are primarily there to provide you with protected time to do the research. So they provide 80%, up to 80% of your salary, which is the general amount of time that they require that you have available to do your research. And they usually have a small budget for doing the research, assuming that the mentor you work with will have a robust budget to allow you to do the research. So they're generally for somewhere between 3 and 5 years of support. They support your salary. You have to actually, I said 80%, you have to devote at least 75% effort to your project. There's a loophole for surgeons who can get away with only 50% because the NIH recognizes that surgeons, for their career, need to devote substantial time to developing their physical skills as well. Generally, you're allowed to submit one resubmission, so you can't keep resubmitting it forever. And for most of the institutes, there's a defined number of years after you've completed your postdoc, or after you've completed your terminal degree, that you have a window in which to submit a K award. You have to require additional training in order to be able to go into the career that you are aiming for. So if you've already got all the training you need, you're really not eligible to submit a K award. The K award is to support you for additional mentored training. And so that's the sort of first decision you have to make when you're getting ready to submit one of these applications, is whether you really need additional training, and that's a significant part of the application. And you need to have strong institutional commitment. And I really would recommend that you, one of the flaws of the process is that often the letter from your department or division director, department chair or division director, often shows up with 24 hours to go before the grant has to be submitted. I would really recommend that you help your person who's writing on your behalf to get that done in advance and get experienced K mentors to look at it. The CCTS has people who are happy to do this, but there are sort of buzzwords that are crucial to demonstrate the kind of institutional support that the NIH and the study sections expect. They want to see that the institution views the research area that you're going into as an important part of the program they are trying to develop. They want to see that they think you're the right kind of person who's going to fulfill their needs. They want to see some institutional money behind you. They want to be clear that your academic appointment won't be dependent on you getting the grant. You need to be somebody that they care enough about that they're going to support you whether you get this grant or not. And so those kind of things have to be touched on in the letter. And the other thing that's, I think, one of the most complicated parts of the K award is that there has to be a plan for how you're going to transition towards independence. And that's tricky because the whole K award is happening in the context of you having working with a mentor who has a budget for the research that you're going to be doing. So the mentor has to have some ownership of the work you're doing because they have to justify how the money was spent, and they need to be an author on the papers that come from it and stuff. But there needs to be a very clear path by which you're going to go from this mentored experience to eventually having your own, soon having your own R01 grant, where you may have your mentor as a collaborator, but your mentor will clearly not be the person driving the research. You'll be the person driving the research. So I want to direct you to, the slides will be available. I'm not sure exactly where Jean posts them, but she'll, if you need help finding slides, the CTSTP has a place where all the slides that have been in our training program get deposited. So if you want to look up any of these particular websites, it should be easy for you to do later. But I encourage you to look at, if you're considering a K award, to go to the Research Career Development Awards page of the NIH, which there are about, I think, 14 or 15 different kinds of K awards, depending on exactly who you are, what kind of training you have, what kind of career you're going towards. And you want to be sure you apply for the right one. And this just gives you a sense of what that page looks like. So the award we're going to talk about is a KO1, which supports a PhD scientist who's doing research that has a substantial bench component. This could have been a K23, I guess, which is a patient-oriented K award, because it does very clearly have as its topic patient-based materials, but some different funding agencies, and the money comes through the institutes. The review process generally goes through the Center for Scientific Review, which is outside of all the institutes. So the different institutes may emphasize different K awards more. So I don't know if that was a consideration in this individual choosing to do a KO1. So most of these awards are for after you've completed your basic training and are transitioning to a faculty position. You can be an instructor, you can be an assistant professor. There is actually one K award that's designed for people who are mid-career and even later who are making a career change. So there are opportunities to get a mentored experience. I don't think somebody my age would be viewed very favorably for that, because my number of years that they'd be able to benefit from the new training I got would be relatively modest. But people in their 40s and early 50s will get a K award to really change their focus of their research. So the KO1, I think I've actually already said all this stuff, so I'm going to skip that slide. The KO8 is one that is for physician scientists who are doing similar kind of research. The K23 is the patient-oriented research career. It's generally for MDs, so that may have been one consideration where Dr. Yara, who's a PhD scientist, felt she wouldn't compete very effectively with MDs. And then there's a K award for people who do primarily computational or biostatistical kind of approaches to research. So just recognize as you're writing your application that the intent of the award is to help new investigators achieve independence. And that's really sort of defined as the ability to get your own R01 grant. So because of that, you really need to include within the application some section that addresses how the work you're doing is going to lead to your ability to be competitive for an R01 grant, and is going to open a field where you'll have a chance to be the person who is the expert who will be able to compete effectively for an R01. You have to really make a compelling argument why you need more training. And one thing that a mistake a lot of people make is to overload their application with training activities. You don't have to have a 3 credit hour course every 6 months during the 5 years of your K award. You probably need to have some academic training that you're going to get as part of your award, but a major part of the training is the training in new research methodologies and new ways to think about the research questions that you're approaching. So you don't absolutely have to have a very heavy coursework career development part of your application. You need some, but you need things that almost everybody puts in courses that are designed to help you learn how to run a lab as the person in charge more effectively, that will help you learn how to write your R01 application as you go forward. And you have to have training in responsible cognitive research and ongoing training in that. And usually there's a few, 2 or 3 courses that you'll take. There's a lot of interest. NIH really likes it if you go outside of your own environment to get special training. So if there are courses that are offered at the NIH or that are offered in association with different meetings, those can be good things to consider. One of the things to be aware of, the CCTS has a program called the mini sabbatical program, which basically is where the CCTS will pay half of the cost up to $5,000, actually I guess it's $2,500 for a short training experience outside of our local environment. So if you think that going to somebody else's lab to have 2 weeks to learn an important technique or to work with their database or to set up collaboration that's going to be really valuable. That can be an integral part of your training plan and is a sort of innovative kind of thing that would be looked on pretty favorably by most review groups. But you really try to be concrete and explicit in the areas where you need training. So you want to summarize your own experience to show why you're a great candidate for them to invest in. So the things that you do really well already and why they have prepared you now for this next step of training that you need in order to be the effective R01 funded scientist 3 to 5 years from now. What that training is going to be. So the application has these main sections. There's a section that describes the candidate, which includes the career development plan. So that's where you tout all your existing skills and your strengths, and then what you need and how you're going to get that. And then the second part is the research plan, which is relatively similar to what you would write in an R application. There's a section about the mentor. Most people have a mentoring team with a clear-cut primary mentor who is the person really responsible for working with you. You need to show evidence of a real relationship with that person and a commitment by them to support what you're doing. It's a sort of fine line to figure out how much time you have to work with them. Most people say that they're going to meet weekly or every other week with their primary mentor. Secondary mentors usually have fulfill something that the primary mentor doesn't have. So if you're a physician scientist, for example, and your primary mentor is a PhD scientist, you'll probably want a physician secondary mentor who has experience in helping people navigate the issues that are sort of specific to physicians who are trying to carve out a research career in a setting where they have to do clinical work as well. If you're a PhD scientist and your mentor has expertise in one of the areas where you need new training, you may need to bring in an additional person for other parts of the training. Mentor teams more than 3, generally people scrutinize pretty carefully and worry that they may be very hard to manage. So it's fine to have consultants to do specific things. I think it's always good to have a biostatistician as part of your team, whether they're a co-mentor or whether they are a consultant really depends on the extent to which you anticipate trying to doing statistically intensive research going forward, in which case you might want them as a co-mentor, or whether they're really there to help make sure you are, that you would probably get a consulting statistician for every project you do going forward, then use them as a consultant here as well. Then there's the final section is the environment and institutional commitment. Pretty much you should score the best possible score on this. So I hope all of you know that the scoring system goes from 1 is the best score and 9 is the worst, well, not recommended for funding, or NERF is the worst score, but 9 is the lowest given score. So you should get a 1 on institution. If you don't, then you need to rewrite your application and you need to get institutional commitment that's a 1. And so that's where having people who are experienced with these applications can help you decide whether the letter you've got fulfills that or not. There are a few other things. So a few years ago, the NIH, really in response to recognition that there are a substantial number of studies that people can't reproduce, started an initiative called Rigor, Reproducibility, and Transparency, which here at UAB we call R2T. And so the part of that is to be sure that you describe the foundation on which you're basing your research and really evaluate the validity of the foundation. So just because something's published doesn't mean that it's correct. And so you need to make sure as you write your application that everything that you're basing your research on was rigorously done and is reliable. That means you have to reproduce some of the things that people who've gone before you have done. Not everything, obviously, we'd waste too much of our time if we reproduced everything, but crucial things. You need to describe how you're going to be transparent with your own research results. And one of the things that you need to do is provide information about key biological or chemical resources that you're going to use and how you'll assess that they're really what they claim to be. So we use a lot of antibodies in work. We use a lot of drugs that are supposed to have specific functions. So you need to describe, if you have key reagents like that, how they will be assessed, and you'll know that they're really providing you with the resource that you are counting on. So that's under the authentication part.
Okay. Quick question about what you just said, the training and RCR. Is it required to have the training class 1 and 2, or just 1?
I'm not sure. I didn't really understand what you mean.
We have here at UAB the Kaizen class. It was an
Kaizen,
RCR.
yeah.
It was 1 and 2. For the K award, do we need both trainings?
I don't think the NIH knows about both of them. I'm not sure. What's the difference?
I'm sorry.
So there's 2 different Kaizens?
Yes.
For R2T?
Yes, there's R2T. That is for training for rigor or reproducibility.
So I think so you need to have training in responsible conduct of research, which is quite extensive. And most people, I think you're required to take a whole course. There's GRD 717, I think is the number, which is, it's a number of online modules and then a full day face-to-face meeting to discuss ethical issues in science. So you have to do that as part of your K training if you haven't done it already. But for the and
I signed up for 2, so that would not suffice. I have to take the additional.
For the rigor and reproducibility, that will. There's no requirement to take a course in that, but that's really for your benefit to understand the issues. But for the responsible conduct of research, there's a very scripted topics that have to be covered, and that is through a course called GRD 77. That stands for Graduate School 717.
Yes, if you've taken the R2T course, then that's all you would need. And if you've taken it, then you've got documentation that you've got that. If you're federally funded, you have to have that training.
For rigor and reproducibility.
Correct.
But for the responsible conduct of research, that's a different course altogether.
And we do not offer that in the Kaizen game yet. We may eventually, but we don't yet.
Thank you.
Okay. And then there's a section for justifying use of vertebrate animals and safety of human subjects research. That's quite extensive as well. Yes?
I was just going to ask, when you were talking about as far as the co-mentors and consultants and things of that nature, do you know if there's generally a strength in having them all within your institution, or if they're looking for collaboration outside the institution? I wasn't sure.
So for the group here, we have about a dozen people coming in with GoToMeeting from outside. So I think they can hear pretty well when you ask questions, but I'm going to just repeat. So the question was, for a mentoring team, do the study sections like it if you have individuals from beyond your own institution? So I don't think there's any requirement for that. What I think they like to see that you have all the expertise you need. And they're very open to having people from outside your institution. I think they view it as a plus if the person is the best person to give you support, but they really need to know that you are going to be able to execute on having them be an integral member of your mentoring team. And what that generally means is that you either have already established that they join you on Skype video conferences with some other members of your mentoring team once every 2 months or something, so that they are clearly well integrated into the process. A lot of people say that they will have a meeting of all their mentors at the national meeting, that it's likely that all of these mentors will come to together, that that's some opportunity where everybody will be together for face-to-face. There's, I think, a general feeling that the mentoring team needs to meet face-to-face, or at least in some way meet together at least a couple of times a year. It's not necessary that the co-mentors be present all the time when you're meeting with your primary mentor, but at least a couple of times a year that there's get everybody together so everybody's pulling in the same direction on your behalf. Okay, so one other thing I just want to encourage you to do is to look at the score sheet that that the reviewers use. And you can access this by going to critique templates for K Awards. If you do NIH critique templates for K Awards, you'll get directed to this page. The link is up there. And each of the sections where, so overall impact, that's the score that you're going to see ultimately. There's a score given for each of the other sections. So the candidate section will get a score, the career development plan gets a score. The overall score often is, when I review, it's often the lowest score of all the scores that I've gotten, although it may be a little better than the lowest score, but it's definitely not the arithmetic mean of all the scores. It's the sense of what the application's real potential to transform the field and to transform you in the K Award from an immature scientist to one who's ready to be independent. Now, I shouldn't have really said that way, because there have been times when I've given scores of 3 to 4 for most sections of the application, but given a 2 to the entire application because I thought it all fit together really well and was an important thing, and that the flaws in each of the individual sections weren't sufficient to downgrade it, although there were flaws in each of the sections. And you'll see that in this application too. I think that there are ways in which some sections, there were things the reviewers didn't like, and there were things that the reviewers thought were terrific. So each of those things that's in blue, if you click on it, you'll get to a description of what the reviewers ought to be looking for. So under overall impact, the reviewers should provide their assessment of the likelihood that the proposed career development and research plan will enhance the candidate's potential for a productive independent research career in a health-related field, blah, blah, blah. It's a little more instructive if you look at the other ones, like the candidates. So there are very specific questions that the reviewers are expected to answer. Now, reviewers don't answer all these questions, I've got to say. So, but it's that's the they answer a lot of them, and so you need to make the answers to these questions easy for the reviewers to find. And don't hesitate to use some of the words in here to direct them to this, to say, my prior training covered this, this, and this, so that they know exactly where to look to see what your prior training was. And for each section, there are these kind of guides of to what you should, how you should direct the reviewer to that you're giving them the answers to how to write their review. And really, if you can make their writing their review easier, that's half the battle. So I would really recommend that you look at the template that the reviewers are going to use for your application. They have them for the R grants as well, for every kind of grant that you might submit. and look at those so that you know exactly what it is that the reviewers are going to be trying to focus on. Okay, so we're going to go ahead now and do a review of this application. So the people who are normally in the room are the review panel. In some settings, there is a program officer. So the program officer is the NIH individual who is really responsible for making sure that the program continues. So they speak to the people who control the money about what the program's about, and they really are the ones who make decisions about how the program works. They don't participate in the review other than to provide some information and some introduction. So I'm going to pretend like that person has given their introduction and has disappeared. Then there is the scientific review officer, who is the administrator who brings the study section together and who makes sure that the rules of review are actually being followed. And one of the key rules is that the reviewers are never supposed to say that they want to see this grant funded or that they don't want to see it funded. The review panel their job has nothing to do with whether a grant is funded or not. Their job is to evaluate the scientific merit and the potential of each application to have a transformative impact on the field. So occasionally, I don't know if we'll have a setting where somebody slips up and brings in the F word, but the scientific review officer, who will be wearing this hat, will leap up and say, remember, we're not supposed to be making any funding decisions. And then there's the study section chair, who is a reviewer, also a scientist, but who introduces each application. The flow of each application is that the reviewers give a preliminary score before the grant gets discussed. That's to sort of let the rest of the study section know roughly how enthusiastic the reviewers are about the application, so they can be sort of ready to hear what the review is. Excuse me. And so I'll put this hat on when I am the study section chair, and then when I'm acting as a reviewer, I'll just take it off. Now, I'd like you all to feel free to be the members of the study section who did not actually read the grant to provide a preliminary score. And so after the three reviewers have reviewed the grant, you're allowed to ask questions about what they said to clarify, and you will each give your own score to the application. Now, after we've gone through and discussed the application, the study section chair will ask for what the final scores of the three assigned reviewers are, and let's say they are 2, 3, and 4. That will mean that there's a range of scoring between 2 and 4. And in most study sections, if anybody plans to score outside that range, they're required to put their hand up and explain to the whole group why they're doing that, because they don't want somebody to just torpedo somebody without having defended what they're doing. And they like to have their rationale for scoring outside the range be something that the whole committee is aware of. So we won't actually, I'm not giving you a paper to put your scores on, but just be thinking as you go through whether you would, where you would fall for your score between the range that the assigned reviewers give. Okay, so I guess one other thing. So nowadays people have put in their assigned reviews into a database that's available to all the reviewers several days before the study section meets. And so that's available, and the study section administrator rank orders the applications based on the preliminary scores they got. And generally, the bottom half of the scores don't get discussed. They get the written reviews that the 3 assigned reviewers provided, but they don't get the benefit of any discussion from the rest of the committee or discussion among the reviewers that could modify the score. And then the actual review proceeds from the top scored application first down towards the one closest to the 50% range. And so I actually don't know where this grant stood in the preliminary review, but we're going to just pretend like we've gotten to this next application. Okay, any questions before we start? Okay, so before we get to this point, the committee would have all introduced themselves to each other so everybody knows whose expertise is what, where they come from. Most study sections that meet face-to-face go on for at least a couple of days. People tend to eat together, get to know each other. It's actually a sort of a nice social activity. So there are, usually within a study section group, there are some people who don't get along terribly well, and there are a lot of people who get along great and really look forward to seeing each other. But it's a, it's a group that has to work effectively together. So we'll have done that already. Anybody who is in conflict, which means that they are either from the same institution as the PI or a crucial member of the team, or they have collaborated in the last 3 years on a paper with the person that is being reviewed, leaves the room and never actually, their software that they get to look at the reviews that have been submitted has the reviews blanked out for any reviews that they might be in conflict with. So they don't know who the reviewers were. They don't know any of that stuff. Okay, so the next review is for an application, a KO1 application by Dr. Saren Yara-Fisher, who is an instructor at the University of Alabama at Birmingham. And the title of this project is Targeting Skeletal Muscle to Improve Metabolic Health in Individuals with Spinal Cord Injury. The 3 assigned reviewers are Drs. Cropsey, Gamble, and Chaplin. So could we have your preliminary scores?
3.
2. Okay. So, Dr. Cropsey, could you just give a brief description of the application and the key points that made you arrive at your score of 3?
Okay, this is a 5-year KO1 Mentored Research Scientist Development Award, an initial submission. And what she is proposing to do is to look at the metabolic health in individuals with subacute complete spinal cord injuries. And the rationale and the premise for this is that people with spinal cord injuries are living longer to then develop metabolic disorders such as obesity, which goes on to diabetes and other poor health outcomes. They can have glucose intolerance, insulin resistance, and muscle atrophy. And so what she is proposing is to do an intervention in which she will randomize 100 individuals to either a arm cycling protocol, which is the standard of care, versus a neuromuscular electrical stimulation with the arm cycling. And she wants to look to see about the impact on metabolic disorders, including muscle atrophy and other insulin-resistant markers. So I thought the premise was quite strong. She's talking about the fact that this is an aging population. Most people don't target the subacute phase of spinal cord injury. They wait until people have kind of more fully recovered or reached their baseline before intervening with any sort of exercise intervention or any sort of rehab. So she's really trying to target people much earlier in their injury within the first 6 months. She will be randomizing them for 6 months of this conditioning, and then we'll look at the primary outcomes. So overall, I thought the candidate was excellent. She has a PhD in kinesiology from Auburn University, 2011, and she also did a postdoc in spinal cord injury and skeletal muscle physiology through 2014. And she also has expertise in biology, and she's currently an instructor at UAB Department of Nutrition. She has very solid expertise and develop exercise and nutritional interventions to improve musculoskeletal and metabolic measures. And she has this training in skeletal muscle and molecular biology. I didn't notice any weaknesses among the candidate. I thought her goals were quite reasonable and in terms of her career development, but her schedule of mentoring meetings is too infrequent, I thought. So that was a weakness. I would like to see them meet more frequently and have more planned meetings. And then it was unclear to me how the laboratory training would occur. And so I kind of thought that was a minor issue that she needed to address. In terms of the research plan, I thought there were a lot of strengths. She's using a telehealth and emphasis on therapy in the home setting, which is important and novel. I like the fact that the non-medication approach to dealing with obesity and nutrition and for improving health. I like the focus that she's focusing on muscle mass and metabolism really early in spinal cord injury, which I think is important. And it's really a direct extension of her work, where she's looked at other insulin resistance after spinal cord injury. She's going to focus on two main approaches. She's going to study the mechanisms that will underlie the influence of skeletal muscle environment on metabolic disease and in people with spinal cord injury. And then she's going to hopefully develop an optimal exercise prescription that can be then used by providers that can prescribe to patients immediately after their spinal cord or shortly after their spinal cord injury to optimize metabolic health. I did note some weaknesses in her training in the research plan. So I thought that the plan was pretty ambitious and it will occur in a really large, complex clinical trial, which I think can be a little overwhelming for such a new PI, and will kind of sacrifice her more mentoring and career development preparation. It wasn't clear when she would really have time to gain expertise in writing an R01. And this was my biggest concern. I also thought her entry criteria would permit enrollment of a person with an ASIA C5 level. I wasn't clear that would really would truly test our study hypothesis. Thought, again, entry criterion 4, that they're within the first week of initial inpatient rehab. But, of course, that can occur many different times across post-injury. So I was a little concerned about that, and she should create a maximum time of when people can enter. It wasn't clear to me how they would do all the human contact. Would it be live? Would it be by phone or other kind of internet means? And then I wasn't sure that I don't know how they would measure the arm crank to make sure that that it will be identical across both the intervention group and the control group. It's possible that those people who are receiving the neuromuscular electrical stimulation could be more likely or maybe less likely to engage in the arm crank. They might see the NMES as more sufficient, so they might not put as much effort into the arm crank. I also thought that there wasn't much detail on how they would train participants to use this equipment, so I was concerned about that. And let's see. Oh, she also did not talk about how long each study visit would be. There was just some missing details on the clinical trial that I thought would be important. And then how would you assess compliance? I think that's a big issue as well. And then, so I'm going to, in terms of the mentor, I thought her mentoring team was excellent. Dr. Gower is a very well-known and accomplished investigator. I thought that she has a solid history of mentoring students, so I thought that all boded well. And Dr. Bauman provides excellent support on the exercise equipment, so I think they're complementary in that way. And Drs. Rimmer and McLean are also good strengths to this application. But again, as I mentioned, I think there was limited mentoring plan, like specifics on how they would do advising and career planning. I thought the environment at UAB was excellent. She's an instructor. She has access to world-class equipment and laboratories, and so I thought all of that was great. In terms of protection of human subjects, everything looked fine to me. Sex gender was distribution was justified. She's including both men and women. I thought race was fine and justified for Alabama, and she's excluding age 21, which I also thought was justified. That's it.
Okay. Dr. Gamble? So at this point, usually the study section chair has made it clear that we don't need a whole review over again, really just comments that either specifically amplify things that you thought were specific strengths or things that weren't mentioned in this first review that shaped your score.
Great. So I agree with everything that reviewer one has said so far, and I really only have a few things to really comment on. For the most part, my initial score of a 3 was really reflected by weaknesses that I saw in the research plan. I was pretty, I thought the candidate was outstanding, and the mentoring team and training plan were all really great. So I'll just, rather than repeat all of that, I'll just focus on the weaknesses that I saw with the research plan. So one of the weaknesses that I saw was that, so in one of the aims in which she's going to look at muscle structure and function, I feel like this was really a big missed opportunity because it seems like to me that really the most important, one of a very important outcome here should be to maintain the muscle mass and then evoke strength, as well as look at actual fatigue resistance to see if all of that improves as a result of the intervention. And so she's not really doing any of that. And then the other weakness that I had with the research plan really is based on whether or not I felt like the premise was strong in that if you just manipulate one muscle group, in this case it was the knee extensor, that's actually going to change overall metabolism and the entire overall health of the patient. I just didn't really feel convinced by that, and I felt like that could have been better addressed. But overall, I feel like this is just a really important, significant, and clinical question. And I think this candidate has the research team and environment and expertise to address it, and that the weaknesses in the research plan are certainly addressable.
Okay, thank you. So reviewer 3. So my initial score was a little more enthusiastic. I think I was influenced particularly by the terrific environment at UAB for this type of research. The mentoring team brings skills that are ones that this candidate needs to gain in order to get to where she plans to be. I didn't, so I'm not a muscle physiologist myself, and I'm step outside of my review comments. So that's pretty common that the NIH tries to make sure that the assigned reviewers have expertise among the 3 of them in all areas that are important for the review. Not every reviewer has expertise in every aspect of the project. So it's not uncommon that somebody will revise their initial score based on things they hear from somebody who clearly has more expertise in some aspect of the project than they do. So I'll expose my soul here. So I actually view every time I send in my reviews as a sort of intellectual crisis, because you're putting out your judgment about a project for your peers to see what you think. And I'm always really relieved if my score is within at least 2 of what everybody else's score is. And particularly what's rough is if you think something's a 1 or a 2 and the other 2 reviewers think it's a 6. So the reviewers put themselves at some risk here. But in general, all of us recognize that we have specific areas of expertise and that we people treat each other pretty fairly in the process, I think. Okay, so back to the review. So I didn't emphasize. I think the concerns about the scope of this study being perhaps too large for a good training vehicle for somebody at this career stage are really significant, and that the issues around the mechanism by which the muscle training effect can affect systemic metabolism are significant issues that, looking back, I realize weren't covered terribly effectively in the application. I do think the mentoring team is outstanding, and I agree that the specifics of how the group was going to work together to be a good mentoring team to this individual and how often they would meet weren't as clear as they should be. But overall, my enthusiasm for the project is high, and for the applicant, I think she has really a strong career ahead of her. I started out with a more favorable review, and I still feel like this is an important project.
So I have one thing I forgot to add to my review that may be relevant. So on the inclusion of children and minorities, she said that she was going to exclude those under 21, and I didn't really feel like she really justified that choice for excluding those that are between 18 and 21.
Okay, so for the group, so adults are considered over 18, and so you need to be explicit about why you exclude anybody, any adult, and why you exclude children from the studies, and if there's any gender or racial limitations in the study that you're planning, you need to explain that clearly as well. Okay, are there any questions or concerns or additional points that members of the committee would like to bring up?
That's you guys.
That's you guys.
Or we can ask questions to each other too.
And we can ask questions, right?
I'm confused because I thought that the candidate had much experience. So I didn't understand why this person was coming out going the KO1 route, given her background. So I was confused.
Okay. You want me to address that?
Please.
Okay. So, even though has lots of training, I think she's never really done kind of this sort of large scale, clinical trial. Also, her publication record is, we didn't really talk about, but it's sort of modest. And so, she could really benefit from the 80% or more protected time to really develop that. And so that's why I think she's appropriate.
Yeah, no, I was just a little confused because on paper she looks so strong.
Well, and a lot of people do in review. So,
okay.
But I think the specific using this kind of electrical stimulation approach and a telemedicine kind of approach are relatively new areas for her, and she'll benefit by the interaction with Dr. Rimmer, one of her co-mentors, and I think she has a substantial amount to learn. So they're stepping outside of my role here. So one of the things the committee can do is recommend that the person may only need 3 years, not the requested 5 years, to get the experience, or they may need 4, or they may only need 2. One thing I realized as I was driving in that I hadn't really thought about is that she will have had 2 years of KL2 support before she gets to this point. And I know there are some institutes that would count those 2 years towards her 5 and would say that she is only really eligible for 3 more years of K support. I don't know that that's true in every institute, so I didn't actually take the time to look whether the institute that is likely to support her, which is, I guess.
I think I happen to know a little bit about this one because I have a postdoc that is that applied for F32, who's currently on the same T32 that she was on before. And so then at this particular institute, that's the next logical step would be to go from the T32 to either an F32 or a KO1. So I think that it's in this particular institute, it's by design that way.
Okay.
Let us get the mics to you because we've got a lot of people online, so that they can hear the questions.
Okay, so kind of tacking on to that, so this applicant did her postdoc and then KL2 training at UAB in a similar kind of setting. How do the reviewers kind of feel about that, or is that a bonus or a minus, or can you just talk about that a little bit?
So that's a really good question, and I think one thing she did to try to mitigate, so that generally it's viewed as negative to stay in the same environment for your whole training. So she did her graduate work elsewhere, so that's good. I've seen people who have done all of it in one institution. So one thing she did is that her academic appointment is going to move from nutrition sciences, where she did her postdoc, into the rehabilitation and I forget the name of the department, but Amy McLean's department, which is a significant change in academic environment. So I think that's one of the things she did to try to reduce the negative aspect of staying in the same institution. And particularly if UAB wasn't such an exceptional place to do this kind of research, this would have been a real negative.
The other thing is there is a K mechanism. It's the K99R00, which pretty much requires people to leave their institution and go with their R00 to another institution. Because the K99, you're still kind of a postdoc at that point, and you're transitioning to a faculty position with hopefully a big startup at another institution. But that's really the only K where they really encourage you to move institutions that I'm aware of. Did you have a question? Or?
I'm having difficulty hearing.
Why don't you move forward?
My mic's not on.
Yeah, mine's not either.
So my question was, you addressed a moment ago about not necessarily leaving institution, but going to a different department. But now you just mentioned about with the K99R00, they really do kind of encourage that you go to another institution. How is their thought of, staying in the same institution, but going to a different department? So like if you stayed at UAB and went from nutrition sciences into, say, the School of Nursing.
With a K99R00? I think it's probably going to vary by institute, but you can technically stay at your home institution if they give you a very competitive package to keep you. That's my understanding. It has to be what they would give an outside person coming in, not just you already here. Let me throw a few $1,000s at you.
And the institute and the program officer will review the offers that they get, in detail. And if they don't feel like the offer is sufficient, they won't approve the transition to the R00.
And one of the concerns, I think, is whether you will be able to establish yourself as an independent investigator if you stay too much in the same environment where you've done your training. And for sure, it's helpful to demonstrate your independence to go to a new department. And for one thing, usually, at most institutions, that kind of transition usually goes along with having had a national search for the faculty hire that you represented. And so it's more clear that the institution really chose you among a group of individuals that were competitive, and that it's not just a convenience move. So that's one of the things that the institutional support letter should be explicit about, that the individual was hired into this department through a nationally competitive search, and there were 65 people applied for the job, and 5 were interviewed, and this person was selected as the best person for the job. Yes. So these are just for the online people. I don't really think.
Yes, and I'm sorry, the mics are going for online. They don't go through the house system. That's why you're not hearing it here. But it's for online, and they can hear very well.
Okay.
So along that, what you were just explaining, I'm a little bit confused about sort of the timeline of writing and submitting and developing sort of your mentoring team. So is it expected that the mentoring team be at the institution that you get a job at? Or do you have, like you were just saying, if I write a K award and I'm looking for a job, you know, I submitted that K award, and so I'm a little bit confused in terms of how this all sort of fits together in the timeline.
So you are supposed to have if you're going to write a traditional K, like the KO1, K23, you're supposed to have a faculty line at your institution to show institutional support. Now, you will occasionally get people who are postdocs where but the institutional letter has to be clear that you will move into a faculty role whether or not you get this K or not. Because it used to be you can make it contingent, and so institutions were not really making commitments and would be like, oh, well, sure, if Dr. Jones gets this, we'll make them faculty, but otherwise they're a postdoc. And now, so the NIH has gotten wise to that strategy, and so they've really required it that you have a faculty position or are soon to transition into a faculty position that is non-contingent on your K award. And I've even started to see that if you don't have enough protected time in your current position to do research, they view that as negatively too. Karen and I are mentoring somebody where that was a very strong critique. They had 40% protected time, and NIH came back and the reviewer said, you know, it's just not enough for them to be developing in training in research. Now, the K99R00 is really the only one where you really are most likely going to leave that home institution. Otherwise, when you write a K, you should be faculty or soon to be faculty at that institution. Does that answer your question?
Yeah, and about the mentoring team?
So I can answer that. So I've known several people that had outside people on their mentoring team, including the one that she and I are mentoring. And usually what they do, so I think that's usually seen as a strength, especially if that person is justified, because that's really an expert and leader in that particular field. But generally what I've seen where they've done that and it's been successful, the candidate has created a plan in which they're going to actually go and spend some time in the laboratory of that investigator for, sometimes even a couple months, a month at least, to really be able to get the expertise training.
You do want to be clear on how you're going to maintain contact with that person, though. So I have a mentee at Duke who I'm not their primary mentor, but I'm one of the mentors, and she's going to come visit me in November. And I also, as a K23 awardee, I had my primary mentor was at Hopkins and I was at VCU. And so, you just had to be very clear about how you were going to maintain that mentoring relationship. So it is possible to even have your primary mentor outside the home institution, but you just need to be very explicit.
And ideally, you can refer to a history of actually having interacted with that person productively already. To say that it's somebody who has agreed to mentor you once the award starts, the study sections will be suspicious of that. They need to know that you've proven that you're engaged with each other and that they have a commitment to your career. Yeah. Okay, so we're going to go ahead and this grant ultimately received a score of 30, and generally the pay lines for K awards are somewhere in the low 20s. So she didn't get funded this time around, but any score above or better than 40 is pretty encouraging. Even a score of 50, any score is encouraging, and people resubmit even if they are not discussed, and sometimes turn it around in that next application to get the grant scored. So get the grant funded.
I would just add that in the not discussed category, the line at which they draw, these are the discussed, these are the not discussed. I mean, sometimes literally that line is just a few points difference between a grant that got discussed and not discussed. So, if you get a grant that's not discussed and you look at your summary statement and the individual scores are all pretty good, you can pretty much count on the fact that you were kind of fairly not discussed, I guess. So it still may be worth doing.
And Dr. Chaplin, I'm sorry, we had a question online.
Okay.
Hopefully this doesn't step us back.
Come on.
But is it 100% required to move institutions for is it the ROO?
K99 ROO.
Or do you just have to justify why you'd want to stay at the same institution?
So I can answer. So
Karen
I had it K99 R00. My postdoc was at Vanderbilt and I came to UAB, so clearly I moved. But there are several other investigators here, actually at UAB. Jeremy Day would be one that I could think of that had a K99 R00 and stayed at the same institution with his. So really, I don't know what else to add to what our answer was before. I mean, really, what it boils down to is convincing the institute and the program officer that you're getting an offer that would be even better than if you went somewhere else. Because at the end of the day, like, they just want you to be successful in getting your first R1. And so if it looks like the institution is willing to commit to that and you can establish your independence from your prior mentor. I mean, so Jeremy even stayed in the same department. So it can certainly be done.
Yes.
How do you know whether or not you were discussed? Is it outlined in the?
So when you get your summary statement, it will not have an impact score here because that's the number that comes at the end of all of the discussion, and there will be a note in there.
Could you explain how that score, like what a 12 means?
Right, so a 12 means 1.2 average, basically.
And 1 is the best you can
One
get.
is the best. So 10 is the best impact score you can get.
Right.
So in the A0 version that we just did, the impact score was a 30. So you can pretty much, that tells you that pretty much everybody in the room gave it a 3.
Or an average of 3.
And we forgot to revisit our scores.
That's okay. He summarized it. It's fine.
I forgot, yeah.
We'll do it with the next one.
Yeah.
Okay, right. Yes.
What is an average turnaround time to get to your score back, and then do you have enough time to resubmit for the next cycle? So if it's October submission, do you get it back in time to do something about it for the early February or January time?
So generally, like if you submit in October, grant review will be held probably sometime in February. And so you may not have enough time to turn it around for March. Keep in mind your resubmission is a month later. So the general times to submit are June, October, and February. So your resubmission is a month later. So, but generally there is not enough time to turn it around because they also have 30 days to release your pink sheet. So you'll get a score within the first 3 business days, supposedly. A lot of them will post them sooner. Some will take their full 3 days. But then once you get the score, you still don't know what the review is. And so you need that. And so that's usually another, at least probably, if you got a pretty decent score, sometimes you'll get them within a week or 2. But sometimes if it's like a not discussed, you won't get it for the month or 3 weeks.
I would also caution against the rapid turnaround. I know very few examples of where that was successful, and I've actually had an experience where we turned the other PI and I turned around a grant in a rapid like next cycle, and what happened because she had continuous submission, and what happened was the SRO was unable to get the same reviewers we had with the A0, and it actually went to a really nice, almost fundable score to not discussed.
Wow.
So I would discourage that.
Along those same lines, when from the time you get scored and say, yes, they're going to fund you, what's that timeline for when you actually get the money? And you can like start your project essentially.
A year, 2 years.
So you usually specify in your grant, for example, let's say you submit in the fall, you got your review back, let's say a miracle occurs and they're going to fund you the first time around. Like, let's say you set your start date at July. They may send you the money by then, but they may not. And then they can also backdate you. So they can send you the money in August, but say they sent it to you in March. So that's another lovely thing. So you've already lost several months.
I think
You're behind.
There's a really nice table on the NIH website that shows you, David, you probably know what I'm talking about, where it's got, this is your submission date, this would be the earliest start date. And so usually that's what you put as your start date. They tell you what to do.
And they often like try to fund a lot of stuff at the end of their fiscal year. So you can get a bunch of stuff that you've been waiting to get funded, and they'll fund it like in September.
And from all,
there's a lot of variables that are out of our control, like, you know, this past year when Congress didn't have a budget for so long. I mean, that just really delayed a lot of grants.
somebody asked, so same reviewers are asked to review the resubmission of the same grant?
They try to get at least one of the same reviewers, but it's, as Karen mentioned, I mean, sometimes they're not able to get those same reviewers, and so you have 3 new people that might look at it.
Mm-hmm.
Okay, so how do you approach the resubmission? So you have one page, which is called the Introduction to the Revised Proposal, which, if you have access to the grants, it's page 92 of this application, in which you can summarize what you have changed in response to the review. And I guess the bottom line is you should try to figure out what are the really most important negative and positive points that the reviewers gave you. Emphasize the positives, that you appreciated their recognizing these strengths. And then, so what do you do if you think that a negative critique is hogwash, and that you actually said in your application, you answered this question and they didn't get it, though what idiots they are. So what do you do about something like that? So I guess my message is that they're intelligent people who are doing their best to give a good review. And usually any negative critique you get, even if it's something that you thought you addressed, it's something that you didn't explain well enough, and it needs to be changed. So even if you think that you have addressed the issues that the reviewers are complaining about, my strategy has always been to thank them for the critique, and that you've made the following changes in response to the critique. And in this case, some of the things that were the most serious were that the scope of the project was too big. In fact, if you get the word overambitious in your review, you're not getting funded. You know that. That's a word that it's just a signal that it's not going to happen. So the goal is to be adequately ambitious, but not overambitious. And that takes some experience. But so it's common that people will cut down the number of things that they propose to do between the first application and the second application. So that was one of the critiques. There was issues with the mentoring that all seemed pretty simple to fix, really, in terms of just explaining things better. In this case, really, most of the issues were explaining things better. There were some biological issues that were important, where she could make some really significant changes that should, if she gets the same reviewers, really improve her score a lot. So I'd encourage you to take a look at what this page 92 is like. Don't feel like you have to address every single point that is in the review, because you don't have space to do that, really. It's better to focus on the things that are the most important. Be really polite, acknowledge that the reviewers are trying to help you, and then at the end, make some statement that with these changes, you're confident that, and you appreciate that this has made this a stronger grant, and that you hope they view favorably. And then throughout the application, she's put lines on the side of the page for where the text is significantly changed. That's very helpful to, if it is the same reviewers, they don't necessarily have to read the entire grant every word for word, because they can be focused to the areas where the changes are, and that can be really, really helpful.
I just wanted to add that I thought this introduction was really nicely written. You said, be polite. Believe it or not, I've actually seen introductions that are very combative,
Right.
and it never, even
That
as,
does not help.
I think I was a reviewer on an application that was an A1 in which I did not review the A0, and it left me with a bad taste in my mouth, and I wasn't even one of the original reviewers. So
Right.
you don't want to do that, even if you're right.
Okay, so we're now we're going to review a resubmission by Dr. Sharon Yara Fisher, entitled "Targeting Skeletal Muscle to Improve Metabolic Health in Individuals with Spinal Cord Injury." I'd like to get the preliminary scores from the three reviewers. The primary reviewers, Dr. Gamble, and then Dr. Cropsey and Dr. Chaplin.
1.
2.
1. Okay, now
Great.
Dr. Gamble. So right away, we know that everybody knows that the review panel thinks that the person has been very responsive to the initial review, and that it's a strong application now, and a lot of things have been fixed.
Right. So this is a resubmission of a KO1 application by a junior faculty member that has spent 3 years on a T32 grant, a 2-year TL2 grant. She has her PhD in kinesiology, and in this application, she seeks to address a very important and significant clinical problem, and that is that after spinal cord injury, a lot of these patients go on to develop major metabolic dysfunction, including diabetes, obesity, and so these secondary consequences are often a real problem for these patients and can significantly impact their lifespan as well as their quality of life. And so I really think this is an important problem, and I think this investigator has assembled a great research team and a cohesive research plan to really address this problem. What she proposes to do is to do a randomized controlled trial in a final number of 60 subjects, and in the trial she's going to have an intervention group and a control group. The intervention group will receive neuromuscular electrical stimulation in combination with in which they get a high frequency stimulation as well as a low frequency stimulation. And the importance of that is that these two different types of stimulation are going to stimulate different muscle fibers. So rather than treating one type of muscle fiber, you're actually going to hopefully improve and retain the type 2A muscle fibers as well as the type 1 muscle fibers. And this will be targeted in the bilateral, so both sides of the quadriceps. The clinical trial will last for 3 weeks, in which they will receive this intervention 3 times a week. And this will be early in the disease progression after the spinal cord injury. She's actually added, in response to the prior review, a control group, a sham control group, in which they're going to receive passive dynamic exercise once a day for 3 days a week. And then also TENS, which is an a passive way of aerobically training the muscle. And so basically this control group, at the suggestion of the prior review, is important because this is going to then control for the amount of exercise that the subjects get. And so that was actually really, I found to be really responsive with this revised research plan. Also in the prior review, let me address the outcomes really quickly because I forgot to say that. So she basically has 2 aims. One aim is to address overall metabolism. So this includes glucose tolerance and insulin sensitivity. And then aim 2 is going to look at specific muscle adaptation. So specifically in the muscle, she's going to look at glucose utilization, oxidative metabolism, and then she's also adding, measuring the muscle size, strength, and the fatigue resistance of the actual muscle. And so that was also very responsive to the prior review, because that was one of the criticisms, was there was sort of a missed opportunity for for looking at how the muscle is actually adapting. Okay, so one of the major criticisms from the prior review was that it was a very large and complex clinical trial, and so it seemed a bit overambitious for where this investigator is at her stage, and so she's actually done a good job of kind of trimming this down. She's gotten rid of the Atella exercise portion that was originally proposed, and that she'll actually is still interested in doing that, but we'll do that as part of her future R1. So she's actually done a better job now of describing how she's going to gain expertise for writing her R1. And in fact, UAB was recently awarded a REACT Center, and so this will open the door for her to take a REACT Clinical Trial Design Implementation course, and she'll be able to also participate in the CCTS writing group there at UAB. And so I feel like that was really addressed well in her proposal. I don't want to go through everything that's on her introduction page, but just suffice it to say that my score of 1 was really reflected in how responsive she was to the prior review. I did have some really minor concerns with the research plan, mostly involving just more detail. Like I just wanted more detail of the standard of care. I had a small concern that the TENS in the control group, that in actual stimulating those muscles, that could maybe modify the baseline readings from those muscles. And then, but all of those are very minor and easily addressable. So I just want to quickly go through the review of the candidate. One minor weakness is that she has a modest record of publication. However, she addressed that in her career development plan and has a plan to increase her publication record. I really didn't see any other weaknesses with the career development plan. The co-mentors are really outstanding, with Barbara Gower, who is well-funded. All of them are well-funded. Gower, Barnes, Bickle, and then she includes a statistician as well. And on that note, she actually addressed one of the prior criticisms of addressing the missing data. And she is now going to use an intent to treat in her analysis strategy and a completer analysis, and if that's actually needed. As far as the environment is excellent with the REACT Center, the CCTS. You really couldn't ask for a better environment here in this application. Do you want me to go ahead and deal with the stuff at the end with the responsible conduct of research, or do you want to save that to the end?
Why don't we go ahead, just in the interest of time? Okay.
There were a couple things in terms of grantsmanship that I did have. I really wanted to send a message to this applicant that they should pay attention to in the future. One is the responsible conduct research I really found incomplete in terms of format, and because of that, that was really unacceptable. There were a couple other things in the application. For example, the research summary should be 30 lines, but instead this was a really long research summary. It was like 52 lines. And so that really, just paying attention to those details and getting the instructions. But overall, in summary, I found that this was an outstanding proposal. It's going to address a major unmet need in the clinical population of SCI. And I'm really excited about where this candidate is going to go in the future.
Thank you. Dr. Cropsey, do you have comments?
I'll just comment. I agree with everything that Dr. Gamble has said. I think the candidate, everything is really outstanding. My one area of contention, which is why I gave it a 2 rather than 1, is I really felt the control group was inadequate. They're using the TENS unit, which is a very passive form of electrical stimulation and is really aerobic only. And so I thought what they should be doing is that they should use a high frequency, which is resistant stimulation, and basically disentangle what she's doing with the NMES, which is combining both the low frequency and the high frequency. I think those should be 2 separate control groups. So I really felt like that disentangling what's the impact of the high frequency versus low frequency would be a better control group, and then comparing that to the two together. Because otherwise you don't really know, is two together necessary, or maybe it's the high frequency or the low frequency that's really doing all the work, so to speak. So that was my main critique, but otherwise I thought the applicant was really outstanding, and the training plan, everything was great. I agree, she was very responsive to the previous set of reviews. The only other thing in terms of human subjects is she changed it. She had children younger than 21, which on the previous review we commented was not adequately justified. So she changed it to children younger than 18, but she still didn't justify it. So that's just another note. And I agree that abstract was way too long. I don't even know how this got through NIH, to be honest, or through our OSP. I've had things cut, kicked back for being a half a line too long. So they went quite long.
Okay, and Dr. Chaplin? I agree with all that's been said. I think I was most excited by the opportunity the applicant took to modify her scientific plan, bringing in Dr. Barnes as a new consultant and doing a much more extensive metabolic analysis of the impact of the exercise program that's been proposed. And I think that will serve her very well in her future career development and make the transition to an R grant much more smooth. So overall, it's a tremendous team, a strong applicant, and a very good scientific plan.
Do you want to let the review?
Any comments from the rest of the committee?
Let the reviewers.
Are there reviewers you want to discuss?
Comment on the
Yeah.
Yeah, so I just wanted to address the concern raised by reviewer 2 with regards to having a more specific control group and dividing up the low frequency versus high frequency stimulation. So I think that's a great idea, and I think that's something that she could certainly do in the future in an R01. But I think in the scope of a KO1, especially in light of the fact that she was really criticized in the beginning for having a very large clinical trial study, I just don't think that that is really feasible for where she is in her career. So, that's why, it's definitely a good point and something for her to keep in mind in the future. But that's why I really scored it more of a 1 than a 2 in that case.
Yes, from the audience? I mean, from the rest of the committee?
Yes. I wanted to pick back up where one of the reviewers commented on the formatting. I wanted to know about the references. The applicant had, I think it was like 3 or 4 pages of references.
Yeah, that's not counted in the pages.
It's not.
Yeah,
Nope.
no.
Okay.
So the comments about the references didn't have anything, or the comment about the formatting had nothing to do with the references. It had to do with the format of the responsible conduct of research. So there's a very specific instructions that go with how to write that section.
Yes, she was over the word count.
Exactly. And so
Right.
that was different than the
That
summary.
was with the abstract or the summary.
Abstract.
The summary, that was
Yeah.
the
The
summary.
summary was too many lines over, but there were the responsible conduct of research is a completely separate section in the grant application. And
it's only for training grants, so Fs and Ks. So if you write an R, that's not necessarily, you don't have that same section.
Right.
You have a human subjects or a IACOC section, animal section.
Okay.
So yeah, but you can go online and look at how she should have formatted it specifically.
Okay, thank you.
Are there any other comments from reviewers who weren't assigned? Okay, so before we do that, maybe, so let's revisit the scores now that everyone, that we've had the discussion. Reviewer 1.
I'm going to stay with my 1.
I'm going to go to stay at a 2.
And I want to stay at a 1. So we have a range of 1 to 2. So everybody now does anybody want to score outside that range? So you would put your hand up if you wanted to give it a 3 or a 5 or anything. Okay, so please now, and go ahead and do your score. So everybody clicks it into their electronic score sheet, and then we move on to the next application.
The other thing that we do that we haven't shown you is we talk about budget.
Oh, yeah.
And that's after scoring, so it doesn't get scored. Human subjects does, at least on my panel. That is a scoreable area. So if you have something wrong in human subjects, that does get scored, but budget does not get scored. And with a K, there's not usually too much to pick on, but you can certainly find lots to kind of pick on with an RO1 or larger grants. And reviewers do get an opportunity. They can't say it shouldn't be funded, but they can say things like, well, I don't think they need 4 RAs to do this project. I think they can get this done with, 2. Or I don't think they need that piece of equipment. The institution should be providing that equipment or something like that.
Right.
Okay.
As a reviewer assessing a candidate's publication record, what's more important, the total number of publications or the publications that are in that particular area that they're trying to go into?
Yeah.
A little bit of both. I mean, I think to have no publications in the area they're moving into is a negative, but to have maybe only one is not a kiss of death, but then they need to have evidence that they've been productive in the area they're coming from.
So for this candidate where it says modest publication record, was it, I didn't get a chance to look at her CV, but do you guys know like how many she had, and like were they just kind of focusing on first authors or
Right.
just 4 first authors, but like they didn't count anything else
I
technically?
think they said like over the span of 9 years or something like that, and that was why.
I think because she had a postdoc and then she had this, the other opportunity. Her publication modest was modest compared to other people who had those postdoctoral opportunities. But again, I don't really know.
Yeah. So I guess maybe if you guys know off the top of your head, like what's probably an ideal number of publications one should have after doing, let's say, a 3-year postdoc and applying for a K in general?
I hate to say this, but this actually probably is somewhat dependent upon field. It also depends on the impact of the publication, like the journal that you're publishing in. Like you could have a gazillion little publications in little no-name journals, and it's not going to really do you any good. Also, I know so Ken and I are from completely different backgrounds. So she's from a psychology background, and I'm from more of a biomedical sciences or biology background. And I think in psychology, you really should have a lot more publications than you would necessarily expect in biomedical sciences.
But that's an area where you really need your mentor to help you make a decision. And it's actually, it's common that your division director is pushing you to apply because they want you to have the funding, and your mentoring team knows you're not really ready and that you'd be better off waiting to get this paper published that's important.
Thanks. So it seems like when in looking at the resubmission, you're considering the feedback from the previous one. So is that something that reviewers are receiving as part of the package?
Yes.
Or okay, so you're not looking at it as completely fresh.
So let me tell you what you get. When you're a reviewer, first of all, we don't see each other's reviews until like a day or 2 before the review. So I can't the reviews are due, and after the review due date, then they release them all. So then I can go look at, but I still don't even know who the reviewers are. Right.
They don't actually release the reviews until you've submitted your own.
Right.
So if you're late putting yours in, you can't see the ones that have already been put in, even though you can't copy somebody else's review.
Right. So, and then you still won't know who those reviewers are on all the applications that don't get discussed. So you won't know who reviewer 2 was or reviewer 3 or anything. But then for the NIH side, when you're a reviewer, you'll see the new application, you'll see the old summary statement, and the new application will contain that introduction page.
So I have one last comment. You've probably noticed that like I'm a little under the weather today, and I just wanted to point out that that's actually real life in that I think all of us have probably served on study sections in which you feel like you would definitely rather be in bed. And so it's important to keep that in mind when you're writing your grant application, because it needs to be like so simple and well explained that even if your reviewer is on all kinds of cold medication, that they can understand what you've written. And a lot of times you could hear from how the discussion went that how you sort of sold the application to your other reviewers or to the rest of the panel can really, really impact the score that everybody gets it. And so if I'm a reviewer and I come to the study section and I'm sick and I really don't want to be there, when I talk about that grant, I may sound like I'm really not enthusiastic about it, even though I really am. So it's just to keep in mind that, these are real life people, they're active scientists in the field, and so life happens.
Online. Can people at UAB CCTS Partner Network Institute include resources available through UAB CCTS in a K award as part of the environment available? If so, what do we need to do? Get a letter of support from the UAB CCTS program?
So the answer to that is yes, to both parts. I think if you want to take advantage of resources that are at a different institution, it shouldn't be limited to people. So the CCTS has a partner network that are defined institutions that are part of our grant application, but you should feel free to take advantage of resources that are crucial to you anywhere, but as long as you have documentation from the institution where the resources exist that they plan to make them fully available to you, and it needs to be very explicit about whether you're going to have to pay for it, what your priority is going to be to have access to the resource compared to local people, blah, blah, blah. But that all is fine and would be viewed as a strength to be taking advantage of the best resources that are required for the research you're doing, as long as your plan to use those resources seems practically achievable.
Another one. NIH regularly announces research areas of interest and priority. Assuming a grant submission aligns with those areas, how and when does that play into assigning scores? Would the PO mention them?
So I'm not familiar with that playing much into the K process very much. So usually there are requests for application that are priority areas that yield ultimately their own specific review panels. And often, so about, I think, 70% of the reviews are done through the Center for Scientific Review, the CSR, and the other 30% are through review panels that are actually organized by the institutes. And usually the specific, many of the specific requests for application have review panels that the institutes organize. And so the scoring usually is done by the study sections in the normal fashion. And there are opportunities for the program officers and the council for each institute to rescue grants that fall below the pay line because they fall into a priority area. So that's one of the ways in which you may get a funding notice at the end of the year when there's, after the council has met and there turned out to be enough money to support your application, which on its score wouldn't have gotten funded, but because it's an area that the institute is particularly interested in, they think it's worthwhile to take the risk of funding something that's not quite as strong a score. Okay, I know. Dr. Gamble was out of the room when I introduced Dr. Cropsey. So Dr. Gamble's professor in the Department of Psychiatry, and thank you very much for participating as well. Psychiatry has really pulled their weight in this process. We really thank you very much for your participation. I hope you found this a useful process. We try to adjust these a little bit every year, so you'll get a little survey asking you for feedback about this session, and I hope you'll give us a thoughtful and polite but hard-hitting critique that will help make this a more effective presentation next year. I have a little bit of time. I know both Dr. Gamble and Dr. Cropsey have things they've got to get to. I can hang around for 10 or 15 minutes if there's additional questions. Thank you all for your participation, and thanks, Karen and Karen.
See you later.
Okay, thanks a lot.
People to reject